This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We're brought to you by the Butterfly Network.
We are. All right, I'm going to let you in on something that's completely changed the way I practice. I've been using Butterfly probes for years. It's a portable ultrasound that plugs right into my compatible smartphone or tablet, so I can start scanning at the bedside in seconds. If you've used older versions, or even if you're new to handheld ultrasound, let me tell you why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty amazing. Biplane imaging lets me see short and long axis views simultaneously, huge for procedural guidance and a great tool for learners. The new needle out of plane preset even shifts the scan plane digitally so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, the IQ3 holds up against some of the high-end cart-based systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
We are once again talking about a hot topic in the news. Tylenol
Hot topic, yes.
and autism.
Yeah.
Is there a correlation? And now the case kind of is ramping up against said
medication, yes.
medication. And, you know, are lawmakers getting behind this, potential lawsuit against Tylenol, the brand?
Is there a lawsuit now?
Well, they're talking about a potential lawsuit because people are coming forward
and claiming, because of this. Sure.
Okay, so let's just break it down piece by piece here.
So what is Tylenol,
Dr.
right?
Brian
That's number one. What is Tylenol?
What is Tylenol?
Tylenol is acetaminophen. It's a centrally acting pain reliever and fever reducer. So it works in the brain.
Okay, so how does it work?
Well,
break it down for us scientifically.
Oh, man. I'm going to have to go back and look at the exact mechanism of action. So it reduces... It activates a portion of the brain that reduces fever and pain. I can't remember the exact.
So it's acetaminophen,
right? It's not like it's not like Advil or naproxen.
It's not touching the nerves itself.
That's
or
not the peripheral nerves.
Nerves.
Right. It's not reducing inflammation the way that the COX inhibitors do. That's what it's called. COX, whatever, 1 or 2 or both.
So it's
working in the brain.
The sensors in the brain that says you should stop feeling this pain now, but it's not
your fever
fixing the pain.
Correct. So that's Tylenol. It's been around for a long, long time. Acetaminophen
helps with heart attacks.
No, it's not a.
Is that an Advil?
That's an aspirin.
Oh, that's an aspirin.
Yeah,
okay,
so
different things.
Yeah, so those are all anti-inflammatories, right? Those are COX-2
Advil,
naproxen, aspirin, those medications. Tylenol is a completely different class of drugs. Goes to the brain.
Okay.
Okay.
Now, where does the link come in between what they have? So it's pregnant mothers who have taken Tylenol during pregnancy, and they claim that the child who is born has autism.
So they don't know the mechanism. And the studies, so there's been 3 of them. There was a Swedish study 5-6 years ago, small study.
So a while ago.
Yeah. There was a study at Sinai in New York. And then there's been a couple of people who have done some just position papers on it recently. But the big one was the one at Sinai. And it, just to be completely accurate, the Sinai study does not say that Tylenol causes autism. It says that there's a correlative link between taking Tylenol when you're pregnant and kids having autism. So correlation is not causation. So this is like a statistics thing, right? So just because 2 things are true and happen in time at the same time does not mean that one causes the other.
So just because you took Tylenol
when you were pregnant
doesn't mean, and because your child has autism,
it doesn't mean they're causative. It doesn't mean that taking Tylenol causes the fetus, then baby, then child to have autism.
What? Okay, so autism.
Yeah.
Okay. Break down medically speaking.
So there's a wide range. They're called autism spectrum disorders now, and I can't remember the exact criteria that they use to diagnose autism. But essentially, it's inability to form connections, inappropriate social behavior, and I mean, you can think to the kind of farthest degree. What is somebody that you know with autism? What do they act like? Now, there's probably some degree of diagnosis here, right? So, like when we didn't really diagnose some of those autism spectrum disorders, like Asperger's disease,
Right.
25, 30,
Correct.
50 years ago, you would just say that person is different. Right? They act different. Now there's the diagnosis. So there's probably an increase in diagnosis, but I don't think the increase in diagnosis correlates to it's like 1,000-fold increase in autism diagnoses. I don't think that just, broadening the definition of autism has increased it that much. Now, yeah, go ahead. What are you going to ask?
Well, no, I'm just wondering, okay, so you just explained medically what autism is.
Yeah.
You explained medically how Tylenol affects your system.
Yeah. How does it come together?
Right. Medically speaking, how does that happen?
So best guess, if it's true that autism has some link to taking Tylenol while you're pregnant, that Tylenol does pass the placenta barrier, the blood placenta barrier. It does get to the baby. So
whatever you put in your system,
not everything,
but
but Tylenol definitely does get to the baby. Potentially, it goes to that portion of the brain where it typically affects fever and pain, and is detrimental while it's still growing, while the brain's still growing. I don't know. I don't think that none of those studies have really postulated what they think, if it is a causative effect, a causative relationship. None of them have really posited how they think that Tylenol causes the autism. So, I mean, it's interesting, right? And it's not new. I think it's been politicized because of who said it, but it's not new, right? Tylenol itself has for years said we don't recommend, and this is another topic we can get into, but we don't recommend. We also don't not recommend, but we don't recommend. We're not saying, oh, this is a great drug, take it when you're pregnant, right? It's not like folic acid where they say you should take folic acid when you're pregnant, right? So it falls under a class C during pregnancy, which means there is not enough data to recommend for or against. So you have class A, B, C, D, and E, I think. And so A is completely safe during pregnancy, right? So folic acid, if you take methylated folate when you're pregnant, that is 100% safe during pregnancy. Then you have drugs like thalidomide, right? You remember hearing about thalidomide, right?
Exactly.
That's an E, I think is what it's called, which is known, documented detrimental effects to human babies.
Growth.
Yeah. So you've got
Maturity,
all the way the spectrum
whatever.
from A to E, and almost everything falls in C because nobody takes a stance on whether you should take the medication while you're pregnant, and nobody's going to run a study where they're like, all right, we'll give these women Tylenol and give these women a placebo.
So, like, where does deli meat fall into?
Well, that's a food, not a medication,
I
so it
guess.
wouldn't fall
Yeah.
in there. I mean,
Just randomly asking, like, right?
yeah,
I mean, there's all
some,
these
there's
things
some
that come
detrimental-
out.
There's some potential detrimental effects that can come from deli meat, from raw eggs, from raw fish, right? So,
But they're not medications.
they're not medications, right? So they wouldn't fall in there. But almost every medication, so Benadryl, Zofran, everything, all these medications are class C, right? There are very few that are even class B, which is there may be detrimental effects, but we don't think so. And then very, very few that are class A. And then the only ones that are class E are the ones that they've already determined because a bunch of pregnant women took them and had problems.
Well, even ADHD medicine, ADD medicine, right?
All of
Right,
it is
yeah.
class C, right?
They don't really.
Right. They don't take a stand on it, right? And it's because you can't ethically do a study where you tell people to take it versus not take it, right? But let's get back to the politicization. Making it political.
Oh my gosh.
Let's get back to them making it them being people making it political. So what the FDA came out and said is don't take it if you don't have to, and if you do, take the lowest dose possible. That's what we tell people for every possible medication out there, right? We don't say, hey, Vahid, I know you have a headache. Go take 50 Tylenol or 50 Advil, right? We don't
take
say
two.
that. You say take one Advil.
Or two.
or 2 if you absolutely need it.
Is there like a milligram dosage that they're recommending people?
Tylenol?
Yes.
Well, I mean, the standard
200, 500.
The standard dose is 325. That's the lowest dose pill, 325 milligrams. They have 500 milligram pills, which I think is extra strength. And then Tylenol is a big issue. We should get into the bigger issue of Tylenol because Tylenol is a really dangerous drug. Honestly.
Really?
But yeah.
Honestly?
Yeah. So we'll get into that. But
actually, as Gen Z says, actually.
These are my kids say that.
It's my kids, yeah.
Actually. Yeah. So if you take 325 milligrams, you take 2 of those. That's 650 milligrams. You take that.
Is that considered a high dose?
No, not really. Okay. Every 6 to 8 hours. So what all the guidelines are now is chronic usage. So if you're taking a lot of Tylenol, you shouldn't take more than 2,500 to 3,000 milligrams a day.
That's a lot of Tylenol.
Acute usage, you shouldn't, even if you're taking it, let's say you take it once a month, you should never take more than 4,000 milligrams a day. That's not that much. That's 1,000 milligrams 4 times every 6 hours, right? So 2 500 pills, 2 extra strength.
That seems like a lot to me.
But people do it. And so here's the other problem. There's Tylenol in everything. There's all the pain medications. So
yeah, I mean, when you're like sick,
right? All the prescription medications, hydrocodone, so Vicodin, is hydrocodone and Tylenol, Percocet,
Dayquil,
NyQuil. There's a Tylenol on a lot of things. So you can really easily get the dose of Tylenol up high. If you don't feel good and you do a Dayquil and then you do Tylenol to get your fever down, and then you take more Tylenol, and then you take NyQuil, and I mean you can easily get to 5,000 milligrams of Tylenol.
Is all dumb question? Is all acetaminophen Tylenol?
No, Tylenol's a brand name.
It's a brand.
Yeah,
but who makes that?
Who makes Tylenol?
Yes,
Bayer makes Tylenol.
Bayer. Are they behind most acetaminophen?
No, there's a bunch of generic companies. So the way it works, you patent a drug.
Yep.
The way it works now, Tylenol I don't think was ever prescription, but you patent a drug, you make it prescription, then you cut the dose down, you make it over the counter, and then once it goes off patent, then anybody else can make it. So you can walk into Martin's and get Martin's brand acetaminophen. You can walk into Meijer and get Meijer's brand, Target brand. You can order Amazon's brand online, right? You can get any kind of acetaminophen. I use it interchangeably because people know the word Tylenol, but Tylenol is just acetaminophen. So
what would you use instead? Or would you just think acetaminophen in general is what you're saying, or do you have a specific, not issue, but you have specific questions about Tylenol itself?
No,
as a brand or acetaminophen?
Yeah, Tylenol, the brand is.
And you did your PhD on this specific thing, right?
Not Tylenol specific.
No, but pain.
But pain the mechanisms of pain. How pain works.
And so why is acetaminophen so dangerous?
It's an incredibly dangerous medication. People think, it's just over the counter. It's Tylenol. You give that to kids. So there's a few things. One, it's really easy, like we talked about, to get a really high dose. And what it does is it goes to your liver. It destroys your liver. I can't remember. It's NAPQI, I think. NAPQI is the enzyme that it breaks it down into. But anyway, so people think it's safe. You get a high enough dose, it will destroy your liver. It will send you into fulminant liver failure, and there's no antidote for it, and there's really nothing you can do for it. People don't understand that. So like sometimes we used to see this a lot.
And are you talking about high dosages for a long time, or are you talking about even low dosages?
So high dosage, medium dosages for a long time. So if you get up in that 3,500 to 4,000 milligrams a day for more than about 6 months, you have a high risk of liver failure from that. If you do more than about 4,500 to 5,000 milligrams in one day, your chance for fulminant liver failure goes way up. And so we used to see this. There would be people who would take, do essentially a suicide attempt, but they're like, I'll just take Tylenol. It doesn't matter. I'll take 20 Tylenol, 30 Tylenol. It's not going to hurt me because it's Tylenol, right? So it's like a, cry for help type suicide attempt. And then they get to the hospital and you're like, nothing I can do for you. You're probably going to die. So not
because of liver.
Yeah, because of liver.
It shuts it down immediately.
And there's no antidote for it. There's basically nothing you can do. It's just supportive care. So people don't fully understand that Tylenol is not, if you take too many Advil or a medicine like ibuprofen, which is what Advil is, or even aspirin, those medications can thin your blood a little bit. There's ways that you can counteract that, and they can affect your kidneys, but you can go on dialysis. You can't live without a liver. I mean, you just can't. So you could get a liver transplant. It's probably the only way to save you if you get into fulminant liver failure from acetaminophen overdose.
So I'm going to ask the obvious question. You don't take acetaminophen at all?
Not really.
What do you take instead?
I'll take Advil.
You'll take
if I have a headache.
Will it, as a medical professional who's studied this, does it act the same or does it?
It's different mechanisms. I think Advil is a much better pain reliever.
Okay.
Acetaminophen is probably a better fever reducer, but then you can also make the argument, maybe not in pregnancy, but certainly as an adult, you should just have a fever because the fever kills whatever bug is inside of you. So there's no reason. I mean, it can make you feel a little better to not have a fever.
So what do you give kids in that circumstance?
So you can give kids Advil. You can give kids, it's Motrin in kids, that the ibuprofen. It's, as early as I think a year or even earlier than that, you can give Motrin. They're a little bit hesitant to give it to pregnant women just because there's some effects that can happen, especially early on in pregnancy. So, again, though, the point is giving the public the knowledge and saying use the lowest dose possible and only use it if you absolutely need it. I don't understand why that's controversial. I understand that they think the person saying it is controversial because of who they are.
Who is that?
But yeah, but I don't think saying, hey, there might be a problem here.
Yeah.
There's a Swedish study, a study out of Sinai, and a guy out of I can't remember where he was from, but there's another fellow who is doing some of this work as well. They have no tie to the current administration. The Swedish study happened before this administration was in place. And the Sinai study was actually a really well done big study, and I've read it. You cannot say there's a causative link. There is nothing in that study that makes me say this is causative, but there's a correlative link. So why not, if it's not something you absolutely, if it was like don't drink water when you're pregnant because water will cause you to potentially have a kid with autism, that would be different, right? There is a lot of benefit to water, and you're willing to take that risk. If you don't need the Tylenol, don't take the Tylenol. I mean, I say the same thing with Zofran. So a lot of women get ill, get sick,
right?
Morning sickness when they're pregnant. A lot of women take Zofran. It's probably fine. But I wouldn't recommend it if you can get away without doing it. There's other things. You can do ginger. Sometimes that helps. When my wife was pregnant, we did electroacupuncture, or acupressure. So I do acupressure on her. That that helps some. Was it perfect? No, but it helps some. Probably that there's medicines out there with B vitamins and Benadryl in them. Benadryl's not totally safe either, but in my opinion, probably safer than Zofran. So there's other things you can try. But again, the point is there's a big study out there, several studies out there now that say there might be a correlative link between taking Tylenol when you're pregnant and having children who are autistic. Is it the end all be all of why we have more autism now? No. Is the study a clear causative link between Tylenol during pregnancy and autism? No. But the recommendation that you take the medication as little as possible, as infrequently as possible, and only when you absolutely need it is 100% accurate. 100%. And I tell people with every medication. If you sprain your ankle, here's some pain medication. Take it as little as possible and as infrequently as possible so that you stay comfortable, but that you don't take a bunch that you don't need. And then and I'll just say it, the idiots on social media who are going and pounding whole bottles of Tylenol to just prove the administration wrong. Now you're hearing about many of them ending up in the ER and some dying from fulminant liver failure. It's like,
what are you proving in that
you're not
circumstance?
proving anything. The making it political part of it is just crazy to me, because at least everything that I've read and heard, it's not political. It's literally saying take as little as possible.
Right.
I don't know. It's just frustrating. And if any
correlation is not causation, is what you're saying.
Correct. And my instructor when I was doing my PhD, my mentor, used to always say true, unrelated. So something can be true and another thing can be true, and they can be in the same realm, and you can think they're causative, but unless you've shown me, and there's a 4-step process in research that you have to show, and I'm not going to go through the whole that because it's boring and I don't remember all the specifics of it. But unless you can show me those 4 things, there's not a causative link. And so she'd always say, you'd say something like, I've got a bottle of water on here and the table's wet. But she'd say, true, unrelated. Prove to me that the bottle of water on the table made the table wet. You haven't done that. They haven't done that in the studies. So it could be true, unrelated. Right?
Interesting.
So that's what.
And plus, taking those 5-6 extra steps is a lot of money. It's a lot of research. It's a lot of.
Well, and ethically, I don't think you can do it at this point. A lot of things you can't study ethically. You can't knowingly give somebody something that you think is going to hurt them. And
so for a study, that would be unethical.
Right. And you can't knowingly withhold something from somebody that you know will help them. As soon as you recognize that to a certain level of certainty, you have to stop the study. And there's lots of studies that have done that. So I think it's really hard to study that. If the audience takes nothing away from this, the one thing I would tell you is even over-the-counter medications, even, natural supplements, medications, taking them comes with risk, and taking the least amount needed as infrequently as possible is the best policy, no matter what the medication is.
You know what I say?
What?
It's called a drug for a reason.
Oh, that's true. Or a supplement or whatever, anything.
It's called whatever it is for a reason.
Yep. And there's side effects to every medication, every single one. Even if you think it's totally safe, there are side effects to every medication.
Plus, there's a lot of medications that are newer that we don't know full side effects of 20, 30, 40, 50 years down the road. I mean, and this is a true statement here. My father has Parkinson's. Parkinson's doesn't run through our family. He was a farmer.
Could be.
Because of the pesticides?
Could be, maybe. Yeah.
We don't know.
Yep.
There was a study done in Brazil that a bunch of farmers in Brazil, because of the pesticides, a bunch of them had side effects in Parkinson's.
Yep.
Oh. Yep. I mean, side effects last in everything you do, or there's an effect.
Any chemical,
any drug
that
you're exposed to, including medication.
Even over-the-counter medication that you think is safe because you can buy it in Walmart.
Always think there is a bigger person behind that, right? There's a company behind that.
I don't think there's any conspiracy here.
No, I'm not saying there's a conspiracy. I'm just saying, they're out to make money too.
Sure, yeah.
Right?
But, I mean, I don't think they're making a whole lot of money out of Tylenol. You can get a bottle of 500 times. I don't think there's any big conspiracy out there where
I don't think so.
Came out and was we know it causes autism. We got to hide this. That. I don't think that's accurate either.
But over time, over the last 30, 40, 50 years, whatever it's been, now we're starting to see the effects.
But I also don't think there's a conspiracy on the other side where they're like, oh yeah, we're going to get Tylenol. We're going to we're going to accuse Tylenol being the end all be all of autism, right?
If you don't think anything in moderation at this point. Right. I mean, when I'm sick, I'm not taking a whole bottle of Dayquil. Exactly. Yeah. You just got to be smart with some things.
And I think, like I said, you can make the argument that as an adult, or even as a kid, if your fever is moderate, not super high, but moderate, do you really need to take something to bring it down? I know you don't feel well, but there's a reason your body has a fever. It's killing the bugs that are making you sick. So is there really a reason to take Tylenol? And I mean, you could even make the argument that there are a lot better ways to treat a headache than Tylenol or even ibuprofen, right? I mean, most headaches, the exception of migraines or, organic headaches where you have a brain tumor, water is the best thing you can do. Right? So drinking a lot of water, typically it's a dehydration thing. Sometimes it can be related to caffeine. Like if you drink a lot of caffeine, you need or you drank too much caffeine. There's a lot of other things that you could do for headaches. So, I take Advil. If I have a headache, I just pop an Advil because it makes the headache go away in 15 minutes instead of drinking a big thing of water and laying down for a minute and doing all the things that would probably be better. But
you are an expert in this. So we will, if you get a PhD in something, I think you're an expert.
I'm not an expert in acetaminophen and ibuprofen and fever and autism, right?
But you have studied pain management
and mechanisms,
and mechanisms. So you are an expert there.
So here's the other question, though. Why do we think autism is more prevalent? Aside from the diagnosis piece, which we already talked about.
Well, that's right. I mean, so let's say this existed 30, 40 years ago, which it did, right? I mean, okay.
You see a lot more kids with a lot more severe, at least anecdotally, you see a lot more kids with a lot more severe autism type symptoms.
I'm not being political here.
Okay.
I'm just putting it out there. Boy, I'm going to get a lot of crap for this.
You said it, not me. That's Vahid Sadrzadeh, not Dr. Brian Schmutzler saying whatever he's about to
where
say.
my address was. I'm like, we're not going to say that.
1, 2, 3, 4. Nobody cares. No, go ahead.
Are we, as a society, more apt to being diagnosed and finding a name for something?
Of course. Yeah.
This is okay. So
maybe it's self-fulfilling. Maybe we say, oh, autism is more common. We're diagnosing your kid with autism. The kid says, oh, I have autism, and then starts acting that way, like a self-fulfilling prophecy.
Well, I think we have a tendency as a culture
To diagnose everything.
Everything.
It's true.
Everything. And if you're a doctor, if you're a physician, and somebody comes to you and says, we are not comfortable until something is diagnosed and there's a name for it.
Yeah.
I mean, that is right. So I'm going to tell you a story here really quickly.
Let's hear it.
So this is actually interesting timing because there was a story on the Notre Dame running back, Jeremiah Love. I don't know if you've seen that. It just came out, and his parents, when he was younger, said that Jeremiah was different.
Okay.
Like he wasn't reactive to happy or sad or pain or whatever.
Is he a little bit on the spectrum?
And that's what they found out, that, hey, like, he kind of goes by the beat of his own drum.
Yeah.
And he's very particular about certain things.
Yeah.
They sought a diagnosis.
Okay.
And after meeting with the doctor, they decided, you know what?
Let's just let it be.
He just is who he is.
Yeah.
And sports is that outlet for him.
I see. Okay.
And so that was
the story. Is he still that way? You've met him, right?
Yeah, I mean,
I'm not making any
I don't
judgment,
know him personally. I've met him a couple times. He seems great.
Okay.
I don't know him personally to know, is he still particular?
Have those, particular things.
Tendencies and what he does and whatever. I don't know. But is sports an outlet? Is that a way for him to kind of like, break those chains and break those, that's what, the story was.
Yeah.
And that's I give him a lot of credit for coming out and saying like, hey, but you have somebody who didn't seek parents who didn't
want the treatment,
didn't want the diagnosis, right? And is that what we did when?
Probably.
Right? I mean, I don't know.
Yeah.
You're the physician. I'm just sitting here from the point of view of like, okay, what has caused the numbers to spike?
Yeah, I think everybody wants
it. Is it Tylenol?
Yeah, no, I mean,
right, you know what I'm saying? Like,
if gun to my head, do I think Tylenol is what's the main cause of autism? Absolutely not. I think that's ridiculous.
Is it what we're putting in our body? Is it?
Yeah. I mean, I would say the poison in our food and in our water and in our everything, is probably more likely than Tylenol. But I do agree that everybody wants a diagnosis and a treatment, right? We're the supersize me, Big Mac, Happy Meal, I want my food right now society. So you come in and you say, I've got this problem. Well, okay. I mean, I can't tell you how many times primary care physicians give antibiotics when they shouldn't, just because somebody walks in and they're like, well, I have an upper respiratory infection. I want an antibiotic. Well, it's 95% chance it's viral and an antibiotic's not going to do anything anyway. But they give it to them because they want a diagnosis and they want a treatment. It's the same way with like the diagnosis du jour of each decade, right? So you've got like fibromyalgia was huge. Now there's a number of other things that are out there.
But
now,
Gen X, we don't go to the doctor, so well, we do.
I mean, I don't go to the doctor very much, but
because you,
I don't know. I mean, I go once a year, but I also see a functional medicine doc. So I health, wellness in general.
But I think everything. We've talked about this on the podcast before. Everything in moderation.
Yep.
I've taken Tylenol. I don't know. Heather has probably taken Tylenol.
Yeah.
Listen, like but are we going to exceed the dosage every day? Take it every day. No.
Yeah. And the recommendation was not don't take Tylenol. The
Correct.
recommendation was talk to your doctor and use the lowest dose possible, the least amount of time as possible.
Has it been politicized?
Of 100%. You got the word right there. Politicized.
Well, it was the politicization.
Politicization. We can't say
We're
that
going to
word.
get it right at some
Yeah.
point.
Anybody who can say that word correctly can come on the podcast.
I'm
and
sure
say
they're
the
going to
word,
give us
yeah.
crap for it in the
Yeah.
comments.
No, I would agree there's a diagnosis component to it, but I do think anecdotally, looking around, there are more kids who at least are
Sure.
treated as if they have autism and are, I walk around and I see a lot of kids who have those big earphones on, right? Which you never saw when we were kids. I'm not saying that's right or wrong. I'm just saying anecdotally, there's a lot more of that now than there was 25, 30, 40 years ago. So,
Well, and it's not just that. It's many things.
Yeah, of course,
Many
yeah.
diagnoses. Many.
but that's a very clear one that you can see. Like the wearing the earphones thing is a very clear one you can see, and you can walk around and count. I saw 7 of them or whatever the number is today. That's 6 or 7 more than I would have seen 30 years ago.
Mm-hmm.
So,
Well, it's going to be interesting to see what happens here in
Yeah.
the next few months
Yeah.
as they work this out. Do they take legal action? Do they not? Do they change some of the branding on the label, right? That's also what they were talking about.
if they have internal documents that clearly show, and there's some stuff going around online, I don't know if it's true or not. If they have internal documents that clearly show that they knew there was a correlative or causative effect between taking Tylenol, acetaminophen, while you're pregnant and autism, then yes, there should be a suit. If they either didn't study it or had no reason to think there was any correlation or causation there, no, you can't sue them for that. I mean, what? There was no malintent there. And Tylenol's been around acetaminophen's been around for a really long time. So, I mean, it's not like there's a brand new drug that there was some, again, I don't think there's any conspiracy here. And please, anybody who wants to make a statement, please don't take a whole bottle of Tylenol because you're going to die. I mean, you're literally going to die from taking that Tylenol.
You're not my doctor, but I will take that sound advice.
Yes. I think that is generally good advice. And as we say, I am a doctor, but I'm not your doctor. So talk to your own.
But I will take
medical
that advice.
professional.
But I will take that advice. Yeah. This has been Going Under Anesthesia Answered with Dr. Brian Schmutzler, brought to you by the Butterfly Network. I'm Vahid Sadrzadeh.
Probably never Tylenol. I don't think Tylenol is ever gonna sponsor us now.
Nope, never will probably. We're brought to you by
the Butterfly Network.
We'll see you in the next one.